You've seen the headlines. Celebrities like Oprah and Elon Musk are using medications like Ozempic to lose weight. But here's what you might not know. Those same medications could help you with knee pain, and they're just one of several exciting non-surgical treatments that are gaining traction. Now, don't get me wrong, knee replacement surgery can be life-changing for the right person, but it's not the best fit for everyone. Maybe your pain is mild, or maybe it just flares up sometimes. Or maybe you don't have time for that long recovery, because if you don't put your all into it, you may not get the outcome that you really want. The good news though, there are options beyond surgery. Today, I'm walking you through some of the most innovative options, non-surgical, that people are using to manage their knee pain. And they're a lot more exciting than just another ice pack. Let's start with GLP-1 medications, semaglutide. You might know them as names like Ozempic or Wegovy. They're typically used for diabetes or losing weight, but there are studies that are showing that they could be helpful to treat knee osteoarthritis. Here's how it works. These medications, they reduce inflammation kind of across the body. And osteoarthritis, while we don't consider it purely inflammatory like conditions like rheumatoid arthritis or psoriatic arthritis, osteoarthritis does involve this chronic, low-grade inflammation. It's like a fire that's smoldering in the background, and the medications kind of help turn that down. And of course, they help with weight loss. Every pound that you lose is about 4 pounds of extra pressure that comes off your knees when you walk. That's like taking off a heavy backpack that your knees have been carrying around for years. So it's gonna feel better. Early studies are promising, especially for those that are taking these medications for diabetes or weight loss, because it would be hard to get it approved for knee pain at this point. There's just not enough data yet out there. But if you're considering it or you're in that category, talk to your doctor, because there could be a double benefit here for you. Next up is injections. Steroid injections, those are pretty frequently given. I inject them myself pretty often for people, but you don't want to have them done too often. They are good for fast relief. They reduce the inflammation right away, but they only last usually for a few weeks or months, so it's very temporary. And if you're using them too often, that could actually speed up cartilage loss. So it's best to use them sparingly, but you could layer them with other injections, the gel injections, hyaluronic acid. These gel injections, they're also given about every 6 months or so, usually not more frequent than that. And we call them gel injections, and there's more to it than this, but it's kind of like lubricating your joint, using WD-40 to kind of get the squeakiness out. And these injections are better for mild to moderate arthritis. It's not really going to be as helpful if you have severe arthritis. So what do I mean by layering injections? Well, a lot of times if you see the orthopedic, what they end up doing is they may give you a steroid shot, corticosteroid shot, and then 3 months later, since they don't want to give you another steroid shot, they might do the gel injection. And then another 3 months after that, you could maybe do a steroid shot. And then again, another 3 months after that, you could do the gel injection. Kind of buying you time and not using too much steroids. Okay, now let's go a little deeper with injections with PRP, platelet-rich plasma injections. These have been getting a lot of buzz recently, and not just from athletes, it's from people who are trying to avoid surgery and looking for other alternatives. So what exactly is this? Well, your practitioner can draw some blood from you and spin it down in a centrifuge. And what they're trying to do is concentrate the platelets from your blood. And after they concentrate the platelets, they inject that plasma back into your knee. So why do they use platelets? It's because they're rich in growth factors, and these help with tissue repair and reduce the inflammation. It's like using your own body to naturally kind of patch up an area that's having problems. Think of it like this. Instead of calling this generic repair crew, you're calling a personalized team of specialists that know exactly what your body needs, because they are from your body. It's not a guaranteed fix, but in the right scenario, it could help treat the pain longer than something like a steroid shot. The problem is it's not cheap. Most insurances are not covering it. It's a lot of out-of-pocket cost. And not only that, but all PRP is not created equal. The way it's prepared, the concentration of the platelets, and the skill of the person that's giving it to you really does matter in the situation. It's not as standardized. So if you're considering it, ask a few questions. Number 1, how is the PRP prepared? Number 2, what is the concentration of platelets that they're looking for? There is such a thing as too many platelets, but they also don't want too little, so you kind of have to find that sweet spot. What's the target? And typically, how many injections do they recommend? Some people will say it's a one-shot deal, and others will do a series of injections. How does it go in their clinic? And if you know any other people that have had it done there, it's good to always ask them, especially with new emerging treatments like this. Blood flow restriction therapy. This is very new and emerging and used more by physical therapists and in rehab facilities. In this treatment, a cuff, it's kind of like a blood pressure cuff. It's placed above your knee around your thigh, and it's inflated while you do exercise. But it's very light exercise. Your muscles think that they're working harder than they actually are because of that resistance. So you get the benefits of strength training without putting that extra pressure on the knees. It's like tricking your muscles that you're getting a full workout without actually irritating that joint. Studies are showing that BFR can improve strength, improve mobility, and reduce pain in people with knee osteoarthritis, especially when they can't do traditional exercise because it's too painful. But it's not for everyone. It's not something that you want to do at home on the fly. This has to be done with supervision by somebody who's actually trained to do it. And it might not be suitable for you if you have high blood pressure, a clotting disorder, or even poor circulation. So talk to a physical therapist to see if it's a safe option for you. Now on to something cutting edge, geniculate artery embolization, GAE. I've had 2 patients do this recently with their respective orthopedic surgeons, and they both had a great outcome. But it's not for everybody. It kind of depends on the type of problem you have in your knee. So what it is a minimally invasive procedure. So they don't have to put you under totally, but there is some anesthetic involved. It reduces the blood flow that's going to the inflamed part of your knee, which is hopefully helping dial down the pain. So if you think of a bucket of water that's overflowing, you need to turn off that faucet so that water stops overflowing. And that's what they're kind of doing, is cutting it off. So a small catheter is inserted and they use these tiny particles to block the blood flow to the specific inflamed vessels that are kind of feeding that area in the knee that's causing pain. And it's really showing great promise for people who aren't quite ready for surgery but have significant knee arthritis pain. So my patients that recently have done well, one of them had been really avoiding stairs because it really hurt him. So now he's able to go up the stairs. And the other patient, he was having a lot of trouble sleeping because his knee was getting very achy in the middle of the night and it would just keep waking him up from sleep. His sleep is much better. This treatment, it's not permanent, but it can help for maybe an extended period of time. Both of these people experienced improvement pretty quickly, within weeks. But it's not widely available yet, and the long-term studies are still underway. So you have to find an orthopedic that is able to do it, that knows the technique to do it, but it's something that you can discuss with your doctor if conservative treatment isn't working. Lastly, let's talk about radiofrequency nerve ablation. Usually when we talk about this, people get it done in their back where they're having pain over there. But actually now it's being used for knee pain, and it's sometimes called genicular nerve ablation. So this procedure targets the nerves that are around your knee that carry pain signals. So a small needle will deliver heat to those nerves, which disrupts their ability to send those pain signals to your brain, and hopefully reducing that pain overall. This can help with pain relief for maybe 6 to 12 months or even more. And it's repeatable, no incisions, and you go home the same day usually. It doesn't actually fix the arthritis, there isn't much that will, but if pain is your biggest barrier, it could be something worth looking into. As a rheumatologist, I just want to clarify something that is very important. If your knee pain is due to an inflammatory condition like rheumatoid arthritis or psoriatic arthritis, lupus arthritis, ankylosing spondylitis, usually we use medications to treat the inflammation and we want to calm down the immune system. We do not jump to surgery or these kind of procedures usually. But these procedures are more used for knee degenerative arthritis. And you can get that if you have those inflammatory conditions, and over time, even that inflammation can turn into degeneration. Many people, as they get older, they'll have wear and tear damage. I'm sure I have plenty already. It doesn't hurt the same people in the same places. But when you have these wear and tear pains, that's where these non-surgical treatments can come in. They're not meant to replace the treatment with medications or anti-inflammatories, but they can support joint function and reduce pain from the mechanical side of arthritis. So if we bring it all together, and you're living with knee pain and surgery feels too soon, you can't have it done, you don't feel like you're severe enough, or there's something else that's stopping you, there are other techniques that you can try. These are evidence-based options, but different things work for different people. Whether it's GLP-1s, PRP injections, cortisone or hyaluronic acid injections, ablation or embolization, there are tools out there that can reduce pain, improve your mobility, improve your functioning. Don't wait until pain controls your life, especially if you're noticing that you are changing the way you live because of this pain. You're now taking the long way around because you're trying to avoid the stairs, or maybe you used to do certain activities with your children and grandchildren and you can't do them anymore because of the pain in your knees. Yeah, it's tough to get down on the floor and get back up, and that might be just one thing that's bothering you, and you can avoid it and still live a good life. But when it comes to really avoiding activities that you do daily, you've changed your lifestyle because of this knee pain, and it might be time to get it looked into to see if anything can help. If this video gives you something to think about, go ahead, like it, and share it with somebody else who you think could benefit from it. If you want to know more about natural treatments for knee pain, I have another video for that. This video, though, is for educational purposes only. It's not medical advice. Always talk to your doctor or specialist to kind of figure out the best situation or procedure for you. I'm Dr. B with Plant Forward MD. I'll see you next time for more on autoimmune health, joint health, and lifestyle medicine.